Testimony of William C. Kling on behalf of CLOC before the Illinois Senate Health and Human Services Committee. This is in support of Senate Bill 2940. Senator Obama, members of the committee, thank you for the opportunity to be here today to testify in support of Senate Bill 2940. I am an attorney specializing in education and children's health issues, and am here today on behalf of the Consortium to Lower Obesity in Chicago Children, or CLOC. I would like to start by acknowledging Senator Maddie Hunter and her outstanding leadership on developing policies to address obesity. She has consistently demonstrated her commitment to this important public health issue, even before it was making the front pages of the nation's newspapers and magazines. Thank you, Senator Hunter, for your leadership. Obesity is a significant public health concern. You will hear shortly from Dr. Matt Longjohn, Executive Director of CLOC, who will provide background information on this epidemic and what CLOC is doing about it. Let me just say at the outset that Dr. Longjohn has done an outstanding job building a coalition around the issue of childhood obesity in Chicago. After just over a year, CLOC has a membership of over 400 organizations committed to studying the causes of childhood obesity and collectively finding solutions to this public health issue. As is the case in most public health issues, the first step in developing strategies to cure the disease is collecting enough information to make informed decisions. In the case of obesity, we are fortunate that the data needed for basic research is objective and relatively easy to collect. Information such as height, weight, age, and gender give practitioners and researchers a useful data set upon which sound policies can be based. Senate Bill 2940 is a practical approach to collecting this information. The bill, as drafted, utilizes an existing procedure which requires children entering school to submit certificates of child health examination forms. These forms are mainly used for determining whether a child has the proper immunizations and other basic health information. The form is created by the Illinois Department of Public Health in consultation with the Illinois State Board of Education. Included on the form, which is attached to this testimony, is the basic information researchers need to begin the process of assessing obesity. This measurement, known as BMI, or Body Mass Index, is simply measured by analyzing an individual's height, weight, age, and gender. By pulling out BMI data, de-identifying the data, and analyzing the data based on limited geographical information, the researchers at CLOC and others across the state can begin to assess the totality of the issue and develop targeted strategies to address those areas where childhood obesity is most prevalent. I have attached information on BMI for children and teens from the Centers for Disease Control and Prevention, the CDC, for your information. Senate Bill 2940 is meant as a first step. Once the research is completed, CLOC and other organizations can come back to you and other policymakers with a well-developed, proactive strategy to address the issue head-on. In the meantime, valuable information on the school health forms can and should be used to assist us in determining areas where childhood obesity is prevalent. Dr. Longjohn will now give you some details about CLOC's work. Dr. Longjohn, and then I turned it over to Dr. Longjohn. And that was actual testimony that was presented on February 25th, 2004 before the Senate Health and Human Services Committee. And the chair of that committee at the time was State Senator Barack Obama. So that was quite a privilege to be able to testify in front of that committee. So what I'd like to do today in this module is discuss with you testimony. And you will recall that on our continuum of formality, where formal is at the top and informal is at the bottom, the most formal advocacy tool is testimony. So what I provided to you a few minutes ago was an example of testimony, and I want to just kind of break it down a bit for you in a little bit more detail and kind of pull out some of the key factors addressing this testimony. So first of all, if you look at the testimony, you can see a couple of features right from the beginning. First of all, I have a heading, and I have my name, so who's testifying, what body I'm testifying in front of, the policy or legislation, in this case Senate Bill 2940, and the date. You will also notice that the format that I use, and this is a style issue rather than a technical issue, it's more of a style that I have adopted, is that I like to double space or space and a half and use all capital letters. Now, one of the things about having written, typed up testimony is that prior to the hearing in which I presented this testimony, I handed out copies to all of the senators. So everybody got a copy of this actual testimony. And obviously you can post it on websites and you can do other things with the information once you've created it in this formal format. So a couple of things about the testimony that I wanted to point out. First of all, testimony is formulaic. And it's important that when you provide testimony, as many of you may have the opportunity to do in your careers as technical experts, and again, we'll talk about that in a few minutes, but the formula is important because it gives you credibility. It shows the policymakers that you understand the process and that you have a good feeling for how to effectively present testimony. So with this particular testimony, the first thing I did is acknowledged the chairman, Senator Obama, members of the committee, and I thanked them for the opportunity to be here today. I then identified myself and what my expertise was, or why I was there before them. I am an attorney specializing in education and children's health issues. And then I identified the stakeholder upon which I am testifying on their behalf, which in this case was CLOC. I then acknowledged the sponsor of Senate Bill 2940, Senator Maddie Hunter, and I thanked her for her outstanding work. Now again, this is a style decision. Oftentimes, it may not be appropriate to single out an individual legislator because others around the table, and when you're presenting testimony, there's senators kind of sitting in a U listening to you, and a horseshoe listening to you. And Senator Hunter was one of those senators up there. So one of the dangers or risks you take is making one of the other senators feel like, well, why didn't he mention me? I've been working on obesity as well. But in this particular case, Senator Hunter had taken the lead on this bill and every other piece of obesity prevention legislation that had come before the state Senate at all, really. So she was the policy paramour on obesity prevention issues, and I felt it appropriate, and I talked to my client, Clock, about whether we should acknowledge her, and we decided it would be a good strategy. I next kind of defined obesity, and one of the keys is that I use simple language. I read very slowly and clearly and concisely. And one of the reasons why I do that is because some people really get their information, through oral presentation. Some people like to look at the written word. And so I like to give them a variety of options to kind of gather the information as policymakers. So I read slowly and clearly and concisely in very simple language, and language that has affect, that has meaning. So for instance, obesity is a significant public health concern. And I talk about obesity as an epidemic. Now, please bear in mind that in this day and age, in 2012, we might hear the term obesity as an epidemic. Doesn't seem that out of character, out of line. But in 2004, there wasn't as much information about obesity as there is now, and the numbers weren't what they are now. And so it was a bit controversial to use the term epidemic at the time, but it was an attention getter. And as I've discussed with you previously, using attention getters as advocacy tools is critical to getting your point across, to having an impact on the policy issue. So I use terms like epidemic to drive home the urgency, to drive home the need for addressing this issue. I then talked about clock and introduced Dr. Longjohn, and who I would then be turning it over. I then went through why our policy that we're proposing, Senate Bill 2940, adding BMI to the Child Health Examination Form, why that's good public policy. And I gave them several reasons in very simple, concise, clear terms. So it's data that's easy to collect. Most of it is already on the form, so we'll just simply take the calculation of the information that they're already gathering and putting it into a different box on the form. I say that it's a practical approach, and I say that we are simply using a tool that is already in play. So very practical, very kind of reasonable approach. And so that was kind of the heart and soul of the testimony. A couple of really key things that I mentioned in the testimony is that the data would be de-identified, and aggregated. So that was a very important piece of Senate Bill 2940 because, as you know, there are HIPAA concerns and other privacy concerns about gathering health data. So what we said was we were going to take this information and de-identify it and use it more for surveillance purposes. So that was a very, very important part of the testimony. The other thing that I did is mention the Centers for Disease Control. So I once again kind of co-opted the federal agency that's most impacted by the discussions around obesity, and that would be the Centers for Disease Control, or one of the agencies that's most impacted. And I co-opted them into my testimony and gave some information to the policymakers straight from CDC. So that was an important thing to kind of give me credibility, to give Clock credibility. We're kind of upping the ante by including CDC. And then I also said that this is a first step, that we will be coming back with other policies that are more systemic in nature, and which we did. And I will post in the resource room the policy action plan on what we called the Obesity Prevention Consensus Agenda, our policy action plan, that included many of the issues that I've mentioned in using obesity prevention as the kind of example throughout these modules. So you will see that, what some of those other strategies were. But I mentioned this as a first step. And then what I do is turn it over to my expert, Dr. Longjohn. Now, one of the things is this testimony was 3 to 4 minutes long. And that is, in my opinion, and again, it's style. In my opinion, if you go longer than 3, 4, 5 minutes, you are impacting your credibility. You should be able, and you'll recall that in our policy action planning process, that one of the keys is assimilating. And remember, one of the things we talked about in the previous module was assimilating into a 30-second or 1-minute bus stop speech. We should be able to assimilate into a 3 to 5 minute testimony. And I think it's very important because policymakers in the real world, the way that it works is that when there's a hearing on a bill before a committee, there's usually, at the state level, many bills coming before that committee on the same day. There's many people testifying. And you're one of several people that the senators and policymakers are going to have to hear from during that time. And so you want to be short, you want to be concise. 3 to 5 minutes is really the time that you need. If you go longer than that, you impact your credibility. Now, one of the things is at the federal level, I firmly still believe that testimony should be very short. 5 minutes is really a good amount of time. Sometimes it goes longer if it's highly technical, but really it doesn't need to be that long. You can submit your written testimony for the record. Policymakers can see the written testimony. Their staff can review the written testimony. So really what you're saying verbally is a summary, is an attention getter. I don't mean to overuse that word, but really what you're trying to do is emphasize your issue. I can tell you that when you go before a committee to testify, when you walk in the room, it's kind of an awesome feeling. Usually the rooms are in a hearing room that have a lot of kind of feel to it, and there's a lot of people in the room, and the policymakers are before you. It's a little bit awesome. And so you want to make sure that you're effective. And you want to make sure that you get, as I've said several times, their attention. What happens is senators, policymakers are reading the paper, reading other documents on their phone, talking to their colleagues. How then do you get their attention? You must do a lot of eye contact. You noticed in my presentation that I used eye contact. You use voice inflection. You use words that have strong emotive. And again, key to good testimony, as I've said a couple of times, is the balance between emotive and factual. And I think you could feel that in the testimony that I provided. So those are kind of the basics of providing testimony. And in the resource room, I will post this testimony and other examples. I will ask you to find examples of testimony as well and kind of analyze to see good testimony versus bad testimony. So here's some of the strategic questions that you ask yourself or you work with your team on as you're preparing your policy action plan. And you're determining, again, on the continuum of delivery, who is going to provide the testimony on your policy initiative. It's once again a very strategic point. There's many different types of people that you can bring in as supporters of your initiative. And you have to decide who you will use as your spokespeople. So here's some examples. For instance, you can use yourself as a technical expert. In this case, what I did is, as the policy consultant, I introduced the topic. And again, I have, as we talked about last time, I have relationships with a lot of the senators up on the dais. And so what I'm doing is kind of, as an expert, as a lawyer, I'm saying, you know, here is an effective, efficient way of gathering this information. So I'm using kind of my expertise. And I was short. And then I turned it over to my expert, Dr. Longjohn. So one category of who testifies is expert. Now, one of the things, if you're using an expert, is that you want to prepare the expert. You want to make sure that they have their testimony typed out, written. My style, and what I advise my clients, my policy clients, is to read the testimony. Why? Because, as I mentioned, when you go before a body like a Senate committee, you're a little bit awestruck. And oftentimes people are nervous. No matter how much experience you have, you're nervous. And when people get nervous, they tend to talk a lot. And they tend to forget the key points that they wanted to make. So if you're practiced, and if you read your written testimony with good voice inflection, to me that's a very effective way of delivery. And with your experts, you need to work closely with them on how they're going to deliver, and cautiously work with them on their written testimony. Because oftentimes experts think that they're the experts, and they may be on the subject matter, but what they may not be experts on is how to present testimony to a legislative committee. So once again, what you're providing is that expertise to help them, you know, assimilate or draft the testimony in a way that's going to be most effective. Other folks that you can use to testify are stakeholders, or those groups or individuals that are impacted by the policy issue. Hello, members of the committee, I'm the president of the American Medical Association, or I'm the, a member of the Parent Teachers Association, or I'm a nutrition educator with the National Association of Nutrition Educators. So stakeholders are often represented in testimony. You also have constituents. So for instance, you might have a child testify about what it's like to be a child suffering from obesity. And that carries a lot of emotive. I can tell you that when I presented this testimony, the bill right before ours was a bill having to do with something around a choking hazard based on a toy. And the child that actually had to go to the hospital after being choked with this toy was testifying. And so I walked in the room and go, oh my goodness, I'm going to have to follow a kid that's testifying. Because sure enough, when a child or youth testifies before a committee, there is clearly a time when senators put down their papers, put down their phones, and pay attention. Now, of course, you have to very kind of strategically use individuals like youth and kids, because you have to be able to kind of control what they're saying and make sure that they deliver a good message. So, but it's one of those strategies in your policy action planning that you determine whether or not it's a good thing to have a youth or a child testify. Other folks that testify include what we call celebrities. So, there are times in which it is appropriate and effective to use and a celebrity to help promote your policy initiative. There's some good examples. Michael J. Fox is an excellent example on Parkinson's disease. He not only was a celebrity, but he's a constituent because he suffers from the disease. And he actually, when he testified before Congress a few years back, demonstrated expertise. And so he was well versed. It was excellent testimony. It was really, really a good, again, when you have someone like a celebrity like Michael J. Fox, the policymakers are going to pay attention. Now, it can backfire a bit because oftentimes what happens is that a celebrity, first of all, there's a question of whether the celebrity is actually kind of an expert on the topic, and so why do they have any credibility other than their fame on being before the committee? So that can backfire. The other thing is that, and true with all of the folks that you put on your kind of testimony panel of witnesses, that's what it's called, a panel of witnesses, you want to be able to control the flow as much as possible. And with celebrities, if you're able to get them to work with you on your policy initiative, a lot of times it's hard to control the flow. They want to do what they want to do. Oftentimes they're hard to get a hold of. Oftentimes when you testify, you have to go to Springfield or City Hall or even out to Washington, D.C. On very short notice, and it's very difficult to pull your witnesses together at that time. So while celebrities strategically might be a good addition, you need to be cautious in terms of your use of them as strategic. So these are the examples, the types of folks that you use to testify. And again, to summarize, it's important that your testimony is formal. You'll remember from the framework that the testimony is at the top of the continuum of formality. So in my opinion, you should read your testimony. You should use voice inflection to really drive the point home. You should use terms that create urgency, that are attention getters, to get and grab the attention of the policymakers. You should keep your testimony short and very concise. Be efficient and effective in delivering your testimony. And carefully and cautiously consider who your witness panel might be, who you can rely upon to work with as you're preparing for a hearing to provide the testimony. So with that, I will once again be posting examples of testimony on the website and in our resource room, and I look forward to your feedback on that. Thank you.